Hi everyone and welcome to my channel hube. This video of mine is about peripheral neuropathy that results due to damage to the nerves located outside of the brain and spinal cord. These are peripheral nerves. This often causes weakness, numbness and pain, usually in the hands and feet. It can also affect other areas and body functions including digestion, urination and circulation. Your peripheral nervous system sends information from your brain and spinal cord, that is central nervous system, to the rest of your body. The peripheral nerves also send sensory information to the central nervous system. Peripheral neuropathy can result from traumatic injuries, infections, metabolic problems, inherited causes, and exposure to toxins. One of the most common causes is diabetes. People with peripheral neuropathy generally describe the pain as stabbing, burning, or tingling. In many cases, symptoms improve, especially if caused by a treatable condition. Medication can reduce the pain of peripheral neuropathy. Earlier on this channel, I have already uploaded a short video about peripheral neuropathy. I hope you have already seen it. And today I am going to discuss this illness in detail. Well, first of all, let me tell you the symptoms. Every nerve in your peripheral system has a specific function, so symptoms depend on the type of nerves affected. Nerves are classified into sensory nerves that receive sensations such as temperature, pain, vibration, or touch from the skin. Motor nerves that control muscle movement. Autonomic nerves that control functions such as blood pressure, perspiration, heart rate, digestion, and bladder function. Signs and symptoms of peripheral neuropathy might include gradual onset of numbness, pricking, or tingling in your feet or hands, which can spread upwards into your legs and arms, sharp, jabbing, throbbing or burning pain, extreme sensitivity to touch, pain during activities that should not cause pain, such as pain in your feet when putting weight on them or when they are under a blanket, lack of coordination and falling, muscle weakness, feeling as if you are wearing gloves or socks when you are not, paralysis if motor nerves are affected. If autonomic nerves are affected, signs and symptoms might include heat intolerance, excessive sweating or not being able to sweat, bowel, bladder or digestive problems, drops in blood pressure causing dizziness or lightheadedness. Peripheral neuropathy can affect one nerve, that is known as mononeuropathy, two or more nerves in different areas, that is known as multiple mononeuropathy, or many nerves, that is known as polyneuropathy. Carpal tunnel syndrome is an example of mononeuropathy. Most people with peripheral neuropathy have polyneuropathy. You should seek medical care right away if you notice unusual tingling, weakness or pain in your hands or feet. Early diagnosis and treatment offer the best chance for controlling your symptoms and preventing further damage to your peripheral nerves. Now let me tell you the causes. Peripheral neuropathy is nerve damage caused by a number of different conditions. Health conditions that can cause peripheral neuropathy include autoimmune diseases. These include Sjogren's syndrome, lupus, rheumatoid arthritis, Guillain-Barré syndrome, chronic inflammatory demyelinating polyneuropathy, and vasculitis. Diabetes. This is the most common among people with diabetes. More than half will develop some type of neuropathy. Well, on this channel, I have already posted very informative videos about diabetes. You can see those videos, okay? Infections. These include certain viral or bacterial infections, including Lyme disease, shingles, Epstein-Barr virus, hepatitis B and C, leprosy, diphtheria, and HIV. Inherited disorders. Disorders such as Charcot-Marie-Tooth disease are hereditary types of neuropathy. Tumors. Growth, cancerous, malignant and non-cancerous, benign, can develop on the nerves or press on nerves. Also, polyneuropathy can arise as a result of some cancer related to the body's immune response. These are a form of degenerative disorder called paraneoplastic syndrome. Bone marrow disorders. These include an abnormal protein in the blood. I'm talking about monoclonal gammopathies, a form of bone cancer, myeloma, lymphoma, and rare disease such as amyloidosis. Okay. Other diseases. These include kidney disease, liver disease, connective tissue disorders, and an underactive thyroid, that is hypothyroidism. Well, on this channel, Hube, there is a very informative video about hypothyroidism, which I have uploaded few months back. If you haven't seen that video, you can see that now. That is very helpful. Okay. And there are some other causes of neuropathy that include alcoholism. Poor dietary choices made by people with alcoholism can lead to vitamin deficiencies, exposure to poisons. Toxic substances include industrial chemicals and heavy metals such as lead and mercury. Medications. Certain medications, especially those used to treat cancer, chemotherapeutic drugs, can cause peripheral neuropathy. Injury or pressure on the nerves. Injuries such as from motor vehicle accidents, falls or sports injuries can severe or damage peripheral nerves. Nerve pressure can result from having a cast or using crutches or repeating emotions such as typing many times. Vitamin deficiencies. B vitamin including B1, B6 and B12, vitamin E and niacin are crucial to nerve health. So if there is a deficiency of these vitamins, then also you can suffer from neuropathies. Okay. Then in a number of cases, no cause can be identified. That is idiopathic. Now I'll tell you some complications of neuropathy. Well, complications of peripheral neuropathy can include burns and skin injuries. You might not feel temperature changes or pain or parts of your body that are numb. Infections. Your feet and other areas lacking sensation can become injured without your knowing. Check these areas regularly and treat minor injuries before they become infected, especially if you have diabetes. Falls. Weakness and loss of sensation may be associated with lack of balance and falling. Now I'll tell you some preventive measures. Well, manage underlying conditions. The best way to prevent peripheral neuropathy is to manage medical conditions that put you at risk, such as diabetes, alcoholism, or rheumatoid arthritis. You should make healthy lifestyle choices. The habits support your nerve health. Now I'm telling you which habits support your nerve health. Okay. First of all, you should eat a diet rich in fruits, vegetables, whole grains, and lean protein to keep nerves healthy. Protect against vitamin B12 deficiency by eating meats, fish, eggs, low-fat dairy foods, and fortified cereals. If you are a vegetarian or vegan, fortified cereals are a good source of vitamin B12, but talk to your doctor about B12 supplements. Exercise regularly with your doctors. Try to get at least 30 minutes to 1 hour of exercise at least 3 times a week. Well, on this channel I have posted some great videos about exercise, and you can find these videos on this channel. Okay. Also, you should avoid factors that may cause nerve damage, including repetitive motions, cramped positions that put pressure on nerves, exposure to toxic chemicals, smoking, and overindulging in alcohol. Okay. Now I'll tell you about the diagnosis of peripheral neuropathy. Well, peripheral neuropathy has many potential causes besides the physical exam, which may include blood test. Diagnosis usually requires a full medical history. Well, when the patient comes to us, we review your medical history, including your symptoms, lifestyle, exposure to toxins, drinking habits, and a family history of nervous system. If there is any neurological disease. Okay. Then we also conduct neurological examination. Your doctor might check your tendon reflexes, your muscle strength and tone, your ability to feel certain sensations, and your posture and coordination. Now I'll tell you some tests. We may order some tests that include blood tests. These can detect vitamin deficiencies, diabetes, abnormal immune functions, and other indications of conditions that can cause peripheral neuropathy. Imaging tests. CT or MRI scans can look for herniated disc, pinched or compressed nerves, tumors, or other abnormalities affecting the blood vessels and bones. Also, we can conduct nerve function tests. Electromyography records electrical activity in your muscles to detect nerve damage. A thin needle, that is electrode, is inserted into the muscle to measure electrical activity as you contract the muscle. At the same time, your doctor or an EMG technician obtains an electromyogram. He or she typically performs a nerve conduction study. Flat electrodes are placed on the skin and a low electrical current stimulates the nerve. Your doctor will record your nerve responses to the electrical current. Then there are some other nerve function tests. These might include an autonomic reflex reflex screen that records how the autonomic nerve fibers work, a sweat test that measures your body's ability to sweat, and sensory tests that record how you feel touch, vibration, cooling, and heat. Nerve biopsy. Well, in some cases, we need nerve biopsy. This involves removing a small portion of a nerve, usually a sensory nerve, to look for abnormalities. Skin biopsy. Your doctor removes a small portion of skin to look for a reduction in nerve endings. I mean, in some cases, skin biopsy may be needed. Okay. Now I'll tell you about the treatment of peripheral neuropathy. Well, treatment goals are to manage the condition causing your neuropathy and to relieve symptoms. If your lab tests indicate no underlying condition, your doctor might recommend watchful waiting to see if your neuropathy improves. Now I'll tell you about certain medications. Besides medication used to treat conditions associated with peripheral neuropathy, medication used to relieve peripheral neuropathy signs and symptoms include pain relievers. Over-the-counter pain medications such as non-steroidal anti-inflammatory drugs can relieve mild symptoms. For more severe symptoms, your doctor might prescribe painkillers. Medications containing opioids such as tramadol, that comes with the name of Conzip, Ultram, or also doctor can recommend oxycodone, that comes with the name of OxyContin. Okay, but these can lead to dependence and addiction, so these drugs generally are not prescribed unless all other treatments fail. Then there is the option of anti-seizure medications such as gabapentin and Neurontin, and that comes with the name of Neurontin, and pregabalin, that comes with the name of Lyrica, developed to treat epilepsy, may relieve nerve pain. Side effects can include drowsiness and dizziness. On this channel with BP, there is a video about epilepsy, and if you haven't seen that video, you can see that. And I'm telling you that some anti-epileptic drugs also are good for pain treatment in peripheral neuropathy. Okay, which I have just told you. Then there are some topical treatment options like capsaicin cream, which contains a substance found in hot peppers, can cause modest improvements in peripheral neuropathy symptoms. You might have skin burning and irritation where you apply the cream, but this usually lessens over time. Some people, however, cannot tolerate it. Lidocaine patches are another treatment you apply to your skin that might offer pain relief. Side effects can include drowsiness, dizziness, and numbness at the site of the patch. Antidepressants. There are certain tricyclic antidepressants such as amitriptyline, doxepin, that come with the name of Zonalone, and nortriptyline, that comes with the name of Pamilor, have been found to help relieve pain by interfering with chemical processes in your brain and spinal cord that cause you to feel pain. The serotonin and norepinephrine reuptake inhibitors, that is duloxetine, that come with the name of Cymbalta, and the extended release antidepressant venlafaxine, that come with the name of Effexor XR, might ease the pain of peripheral neuropathy caused by diabetes. Side effects of antidepressants may include dry mouth, nausea, drowsiness, and dizziness, changes in appetite, weight gain, and constipation. Well, on this channel with BB, there is also a very informative video about depression. If you are suffering from depression, that video is very helpful, and I also suggest everyone to watch that informative video. Okay. Now there are some other therapies which are used in the treatment of peripheral neuropathy. Well, various therapies and procedures might help ease the signs and symptoms of peripheral neuropathy. These include transcutaneous electrical nerve stimulation, TENS. Electrodes placed on the skin deliver a gentle electrical current at varying frequencies. TENS should be applied for 30 minutes daily for about a month. Then there is the option of plasma exchange and intravenous immune globulin. These procedures, which help suppress immune system activity, might benefit people with certain inflammatory conditions. Plasma exchange involves removing your blood, then removing antibodies and other proteins from the blood and returning the blood to your body. In immune globulin therapy, you receive high levels of proteins that work as antibodies. I mean, these are immunoglobulins. Okay. Then there is the option of physical therapy. If you have muscle weakness, physical therapy can help improve your movements. You may also need hand or foot braces, a cane, a walker, or a wheelchair. And then there is the option of surgery. If you have neuropathies caused by pressure on nerves, such as pressure from tumor, you might need surgery to reduce the pressure. Now I'll tell some information about alternative medicine. Well, some people with peripheral neuropathy try complementary medicine for relief, although researchers have not studied these techniques as thoroughly as they have most medications. And there are some therapies which I can tell you. I mean, there is some problem within these. Okay, first therapy, alternative medicine therapy, is acupuncture. While inserting thin needles into various points on your body might reduce peripheral neuropathy symptoms, you might need multiple sessions before you notice any improvement. Acupuncture is generally considered safe when performed by a certified practitioner using sterile needles. Then there is a substance known as alpha lipoic acid. This has been used as a treatment for peripheral neuropathy in Europe for so many years. But you should discuss using alpha lipoic acid with your doctor because it can affect your blood sugar levels. Other side effects include stomach upset and skin rash. Herbs. Certain herbs such as evening primrose oil might help reduce neuropathy pain in people with diabetes. Some herbs interact with medications, so discuss herbs you are using with your doctor. Then there is a choice of amino acids such as acetyl L-carnitine might benefit people who have undergone chemotherapy and people with diabetes. Side effects might include nausea and vomiting. Then I should tell you about some lifestyle and home remedies to manage your peripheral neuropathy. Well, you should take care of your feet, especially if you have diabetes. Check daily for blisters, cuts, or calluses. Wear soft, loose cotton socks and padded shoes. You can use a semicircular hoop, which is available in medical supply store, to keep bed covers of hot or sensitive feet. Exercise. Regular exercise such as walking 3 times a week can reduce neuropathy pain, improve muscle strength, and help control blood sugar levels. Gentle routines such as yoga and tai chi might also help. You should quit smoking. The cigarette smoking can affect circulation, increasing the risk of foot problems and other neuropathy complications. You should eat healthy meals. Good nutrition is especially important to ensure that you get essential vitamins and minerals, including fruits, vegetables, whole grains, and lean proteins in your diet. Also, you should avoid excessive alcohol. Alcohol can worsen peripheral neuropathy. Monitor your blood glucose level. If you have diabetes, this will help keep your blood glucose under control and might help improve your neuropathy. Well, this was my video about peripheral neuropathy. I hope you like this video. If you have any questions about peripheral neuropathy, or if you want me to upload a video about an illness, that is for that, if video is not already available, just let me know in the comment section, and if I get a time, I'll try to post a video about that particular illness as soon as possible. Thanks for watching this video. See you in next video. Bye for now.